The US now has surpassed 2.8 million cases of COVID-19 in the country. States are seeing record highs in their daily case counts. So for more on this, we're joined now by Suzanne Judd. She's an epidemiologist at the University of Alabama at Birmingham School of Public Health. Suzanne, thank you so much for joining us today. About those case counts that are skyrocketing, when you hear that news, what do you find most alarming about that?
The scariest part about it is that hospitalizations are still about a week to 2 weeks out. Here in Alabama, we're already close to 80 or 85% capacity in our hospitalizations, and we haven't even hit the edge of the bubble. And that's true for a lot of states across the Southeast that are seeing these high numbers of cases. They definitely started in young people. So I think a lot of scientists were optimistic that we wouldn't see the hospitalization rates that we've seen in the past. But the reality is young people eventually go to their jobs and they're around older people, and then it spreads in older communities as well. And those people will be at risk of hospitalization.
So on that hospitalization piece, because I feel like, when the pandemic really first hit, we talked a lot about how hospitals would be overwhelmed. We would run out of beds. We'd run out of ventilators. So I guess not to be alarmist, but I mean, do you think that we could have a situation that we were very worried about at the very beginning, which is hospitals will be so overwhelmed that they're not going to have space for anyone? No one with coronavirus, no one with any other illness. We are just simply going to run out of space.
Without doing something different than what we're doing, without a doubt, that's where we're headed. We're headed to a place where if everyone gets sick at the same time, there just aren't enough resources for everyone to be in the hospital that's going to go to the hospital at the same time. We really want to spread it out over about 3 to 6 months so that the hospitals can handle the capacity. In terms of the fear factor, that's really something every individual has to weigh. I was just chatting with family earlier today, and I said, this is probably the time I'm going to really try hard not to get COVID. Not that I wasn't trying hard before, but at this point in Alabama, this is the time to avoid getting sick. Rather have it happen after the hospitals have some more space.
Well, I'm seeing in Alabama some younger folks actually are attempting to get it with these COVID parties. And we, of course, just had the holiday weekend. And while I know that the celebrations were a little bit more muted, I was still seeing, and I'm sure you did as well, I'm still seeing people on social media, at the beach, going to bars, they're not, wearing masks, they're not wearing gloves. I mean, are you, in your mind, as you're looking at this, are you saying we are starting to spiral out of control? We might need to go back to having stay-at-home orders. We need to go back to lockdowns.
Absolutely. It's what we're finding, at least here in Alabama. The goal of leadership from our governor and our state health officer was that we have to empower people to make the right decisions. And it may be that people just won't make the right decisions. They won't stay out of the bars. And it's tough. You've got 18 to 30-year-olds. They're young. As public health professionals, we've had a hard time getting them not to smoke. And the reality is COVID is similar to lung cancer for them. They don't see themselves actually getting that sick from COVID. So what's the big deal if I go to the bar and have a few drinks with my friends? The reality is that those bars, that's someplace where people are touching their hands and their face because you're bringing your drink to your mouth. Things are moving around, a little bit of alcohol, and people get a little too comfortable. They might grab the wrong drink. It's just a scenario that can lead to increased transmission of the disease. And we're seeing the bars packed.
So I'm wondering, I'm sure because it's summer, people, are getting tired of being cooped up inside, but better to be cooped up inside in the wintertime than in the summertime. But I mean, I honestly thought that the summer was supposed to be a time when the virus would kind of, disappear, that, the virus doesn't like heat. Maybe that was completely wrong, or maybe that was just my misunderstanding. So then when you're seeing, all these increases in spikes in these daily case counts, and you're seeing people saying, I'm going to go outside, I'm going to go and enjoy myself, hang out with my friends. Are you saying, okay, we are now in the midst, or at least on the precipice of that second wave? Or is that still coming in the fall or in the winter time?
We probably haven't left the first wave. We're on the precipice of the first wave getting bigger. And it's likely, at least here in Alabama, that we'll stay up in this first wave for a while, because most likely schools will go back, and we're already going to have a really high case burden when the schools do go back. That's going to lead to even more infection because it tends to move more quickly among even younger age groups. They don't have the social distancing They just don't socially distance the way the rest of us do. They're far more likely to wipe their nose and wipe it on the table than an adult would be. So definitely we're going to see it climb and climb if we don't do something different. And I think you made the comment about summer was supposed to be better. This just shows you we don't know enough about this virus to be able to say anything. So people should try to limit their exposure because limiting your exposure will limit the spread. And hopefully we can eventually get to where Europe is, where we have so few cases that we can really keep it under control.
So Suzanne, I want to kind of just read some stats for you and show everyone at home. We have the charts for Texas. We have them for Florida. Those case counts alarmingly high. Out of New Jersey, the transmission rate is now at its highest level in 10 weeks. Is this all down to essentially people not social distancing? Is this a failure on a public health level of the officials in those states, Texas and Florida, particularly reopening perhaps too soon? Why are we seeing this spike right now?
It's definitely because people are not socially distancing. What we're proving is that left to their own devices, people will not, they'll not maintain social distances because they want to be social. They want to be out. They want to enjoy their summer. I think you'll see a second wave creep up in those northern states as well, especially after 4th of July, because people were disobeying quarantine and isolation. So they were out and about with each other. It'll be a lot harder to get a hold of once the case numbers start to climb outside of Texas and outside of Florida. We're definitely in a situation now that we're really on kind of that hairy edge of where are we going and how are we going to get this back in control.
Now, before I let you go, I kind of want to ask you a little bit about this hopeful good news that we might have around treatment for this. Regeneron saying today that it's in late stage trials designed to treat and prevent coronavirus. I mean, when you hear news like that, are you optimistic that we're going to have something on the market by the end of this year, early next year?
Early next year probably is the soonest, but I definitely think the research that's been coming out in the last 2 weeks is looking really promising. Some of the best news we've seen since it started.
All right, Suzanne Judd, University of Alabama at Birmingham School of Health. Thanks so much for joining us today.
Thank you.